What is keratitis punctate? Keratitis punctate, often referred to as superficial punctate keratitis, SPK for short, or Thygeson's disease, is an infection that can dramatically affect the sight of an individual and can even cause blindness if left untreated. Superficial punctate keratitis is an eye disorder caused by the death of small groups of cells on the surface of the cornea, specifically the clear layer in front of the iris and pupil. Omar Chaudhary explains that superficial punctate keratitis is the characteristic of finding the upper layers of the cornea inflamed, while small white opacities are found just below the surface of the cornea with the characteristic of a negative fluorescent staining pattern. What happens? When an individual has keratitis punctate, there seem to be indications that a dysfunction has occurred in the meibomian gland that can cause inflammation of the meibomian glands, also known as meibomitis, meibomian gland dysfunction, or posterior blepharitis. This causes the gland to be obstructed by thick, waxy secretions, leading to dry eyes. The obstructions can be degraded by bacterial lipases, resulting in the formation of free fatty acids, which irritate the eyes and sometimes cause punctate keratopathy. Although keratitis is not a new disease, it is still largely unknown what all the causes are of the infection. There are, however, multiple insights and theories that scientists and physicians have been able to give on what could potentially cause the disease. Melvin Rote published an article in the Merrick Manual describing some of the causes of superficial keratitis, which can include viral infection, bacterial infection, dry eyes, strong chemical splash in the eyes, and exposure to ultraviolet rays. How did it affect Aldous Huxley? Aldous Huxley was greatly affected by contracting keratitis punctate at the age of 16. Huxley was arguably one of the greatest minds of the 20th century. He was someone well acquainted with science, understanding the physiology of seeing in the physical realm, as he demonstrated in his essay, The Art of Seeing, as well as understanding many of the different interpretations of the mystical art of seeing, as he demonstrated in his famous essay, The Doors of Perception, and his novel, The Perennial Philosophy. However, he has often been misinterpreted in the writing of his literature to be seen as someone only interested in psychedelics and science fiction. A more thorough investigation of his work and life revealed that he was a powerful supporter of science and someone who wrote extensively on many topics. Although most recognized for his novels Brave New World and The Doors of Perception, he was actually a prolific writer and wrote 50 works of literature that included various novels and essays. Despite the lasting effects from his keratitis punctate as a young adult, he did not let this deter him from achieving intellectual pursuits throughout his life. Keratitis punctate arguably changed the entire trajectory of Huxley's life. Aldous initially intended to be a scientist, which made sense because he came from a long line of prominent scientists. Aldous Huxley's own grandfather was a staunch believer in Darwin's theory of evolution and was known as Darwin's bulldog. And his brother Julian Huxley, a prominent scholar and scientist in his own right, went on to start the non-profit organization UNESCO. If Huxley did not temporarily lose his eyesight, it is likely that he would have become a scientist, and we would not have the immense volume of literature that we have access to now. One theory is that Aldous Huxley contracted chlamydia while he was studying at Eton as a boy. Trachoma or chlamydia is one of the potential causes of keratitis punctate, so it is possible that Huxley contracted it while he was at Eton, which in turn caused his blindness. As he mentions in the essay, The Art of Seeing, he contracted the infection at the age of 16, which would make him the ideal candidate for this type of disease, since it is especially common and prominent for those between the ages of 14 to 24. Although Huxley did regain some of his sight, he would remain partially blind for the rest of his life and read with great difficulty. Losing his sight made Huxley branch out into other sections of learning. He learned Braille and read classic works of literature, but with great difficulty. The discipline required of him at such a young age certainly could have prepared him for the voluminous works he would later go on to tackle as a writer. What did Huxley do to recover? In The Art of Seeing, Huxley mentions that he was prescribed to wear glasses and apply an ointment in his eyes. He eventually forced himself to stop wearing glasses and waned off using the atropine for his eyes. Huxley said 25 years later, "At the present time, my vision, though very far from normal, is about twice as good as it used to be when I wore spectacles." Once keratitis is contracted, recovery is not entirely hopeless. It is not uncommon for the side effects to get better with time. Mauricio Alderete Lopez writes in his article that the symptoms can usually clear up after 1 month to 4 years. In Huxley's case, this took a little longer due to the fact that the knowledge and causation of STPK were not developed until much later in Huxley's lifetime. Huxley wrote The Art of Seeing in 1942, and the study that Thygesen released did not come out until 1950. Huxley was fortunate enough to regain much of his sight due to the methods that he explains in his book, The Art of Seeing. Huxley's case further supports Lopez's theory that that individual eyesight can improve after being infected with time. Philip Thygesen. Dr. Philip Thygesen has arguably done the most for the study and development of the Keratitis punctate. He studied and received his degree from Stanford University and later went on to become an ophthalmologist. Thygesen went on to study at the University of Colorado and did extensive work with his colleague Francis Proctor, where they discovered that the cause of trachoma was a filtrable microbe, now known as chlamydia. Melvin Rote mentions that chlamydia is one of the potential causations of keratitis punctate. By 1950, Thygesen published details of the disease in the Journal of the American Medical Association. Since Thygesen did so much research on keratitis punctate, his name is often credited by adding it to the front of it, calling it TSPK instead of SPK. The current treatments of keratitis punctate. When Huxley was a child, he describes the treatment that the physicians of the time used to help his TSPK. They prescribed a strong prescription for lenses and then had him apply atropine to his pupils so they would not dry out, causing a further infection. Currently, medical techniques have improved dramatically since Huxley was a child. Paul Ajamian describes the current treatment for TSPK. He stated, "TSPK usually responds to treatment, but with the disease's many remissions and exacerbations, it can be an extended, time-consuming process. For mild cases, frequent use of artificial tears may relieve symptoms, but many patients require a mild topical steroid. A gradual taper over weeks to months is necessary to prevent immediate recurrence. If these measures don't resolve the problem, a stronger steroid will be prescribed." We know keratitis punctate had a dramatic impact on Aldous Huxley and his plans for the future. And it could be argued that if he did not go partially blind and lose his eyesight due to keratitis punctate, then we would not know him as the author that we have now, and he would not have written the voluminous works that we have access to now. While the infection of keratitis punctate may not be as extreme in today's standards, it certainly was a life-altering event for Aldous Huxley.